Stone on, or you want to just bring him on?
Oh, okay. So they established this COVID transport unit. It's in Jotnia, and I believe in Estumbo.
Right. And so let's get from the Guam Fire Department. He's the chief, Chief Dan Stone. Good morning, Chief.
Hi, Chief.
Hey, good morning, Chris and Serena. How are you this morning?
We're doing pretty good. I guess what can you tell us about, we'll just go back to when you came up with this idea for this COVID transport. Maybe if you could walk us from that point to its implementation.
Sure. So the whole premise behind establishing the COVID transports was in an effort to, well, a couple of fronts. One, obviously, excuse me, at the early onset of this COVID-19 response, we were burning through a lot of our PPEs, our personal protective equipment, from our masks to gowns to gloves and things of that nature. And we were recognizing that early on. And although we were still maintaining an adequate supply of PPEs, we, as contingency planners in the Guam Fire Department and all first responders, is looking at, weeks ahead. And so as we were having this discussion, we recognized that if we were to come to a point where PPEs were going to be more and more of a challenge, how can we help to slow that or mitigate that? And establishing the COVID transport was one of those ideas that were brought up. So basically what this does is it allows us to utilize these particular vehicles for the purpose of picking up seemingly stable PUI patients. Instead of potentially infecting or utilizing the rest of our emergency response fleet to go out to these PUI patients, what will happen is when we get the call through the 911 center, our 911 dispatcher has been doing a phenomenal job of gathering that information, that really pertinent information, so that we can, so they can help us make a decision as we go to the response as to whether or not these patients could be potential PUIs. What that also does help us is when we send a responding unit, or whether it be an ambulance or a fire truck out, we conduct what we call a doorway assessment now. So instead of going straight into a patient, we do that 6-foot patient survey. And when they're gathering that information, if this person seems like they're relatively stable, they may be showing symptoms or displaying symptoms, but they are stable, we would activate this COVID transport unit.
Is there a number? Would they just call the regular 911 or?
That's correct, Chris. So it would be a simple 911 call to 911. And
hey, people were asking in the comments, Chief. Sorry, I know that sounded like a dumb question, but there's no 912 or. Sorry.
Yeah, that's where it all starts. It starts at that call center because, like I said, our dispatchers. I tell you what, they've been doing some tremendous work up at the call center. They're asking all the right questions and being able to relay that information to the responders in the field. And as our responders go out and they get their eyes on these potential patients, they continue that patient assessment and gather additional information. And unfortunately, and I don't mean this in any negative way, unfortunately, we're getting very, very good at it.
That's good.
Yeah, I guess that's good.
I wanted to go back to what you said about the PPEs, but are all firefighters, they're all equipped? Everybody that's on the transport, the ambulance and the fire trucks, they all have PPEs?
That is correct, Sabrina.
Okay, so I was just wondering because if people are asymptomatic and they respond, there was no way of telling that they may or may not have COVID.
No, very, very valid question. And so with the COVID-19, so we've also implemented protocols that we would, at the very least, regardless of what the patient call would be, we would at the very least be using a procedural mask, eye protection, and gloves. And as they do their doorway assessment and maybe a little bit more suspicious that this might be a potential PUI, they would then elevate those PPEs to the appropriate level.
Right. Chief, was this decision made, did it come from any place of we don't have enough PPEs for all the firefighters, so we're going to create 2 specialized units and give them all the gear that they need to respond to COVID? Was it that type of decision that was made with that logistic in mind?
Well, those are that was one of the points that we're using, but mostly the emphasis behind this was driven mostly about we want to minimize the exposure of the department. So if we have these 2 specialized units, as you said, doing those PUI transports, that shrinks the amount of people that can potentially come into contact, most especially our first responders who, through just the information that we were gathering from, the response in the United States and elsewhere, that, if we don't properly protect our first responders and they wind up becoming infected, we've only grown that problem, and we've lessened our capabilities to help, to help flatten the curve, so to speak. So a lot of decision points, our first responder safety is the top priority for the Guam Fire Department, and so as I'm speaking through with my other chiefs, with that being the reason for these decisions is always going to be the safety of our responders. That's how we were able to come up with this idea.
What's the average amount of calls that you guys are transporting for PUIs?
So on average, we average on a daily basis between anywhere from 6 to 8 a day. That does go up, and it has gone down. As a matter of fact, today I received my briefing from our command post, and we're down to just 4 in the previous 24 hours. So, although I'm very optimistic, and the administration has been leaning forward big time on this whole pandemic. I remain very optimistic, but as contingency planners, like I said, we always have to plan for the worst and hope for the best.
So that's 4 in the past 24 hours, possible PUI. Do you transport them to GMH or to a clinic?
That is correct. No,
Okay.
so all PUIs and or surveillance that are deemed PUI or surveillance go to GMH. GMH is the healthcare facility,
The COVID hospital.
PUI.
Now, do you wait for them and then bring them back home?
No, so they'll get turned over to GMH, and GMH will do whatever patient care is necessary if necessary.
What can you tell us about the, not specifics, names, and all that stuff, but the general condition of these PUIs who are being transported?
Well, so again, they all for us, they won't be. There'll always be PUI. Not correction. That's not a fair statement. Not always. Those PUI patients, have been presenting with the standard symptoms and things of that nature, and so we take them over to GMH, and that's where they do the swabbing if they are classified for swabbing and determine if they are actually COVID or positive or negative.
Or if they fit into the priority group.
Correct.
Right.
But are they like walking and talking and,
Oh, I'm sorry. Yeah. So for the most part, I would say the higher percentage of our PUI patients are relatively stable. They present with signs and symptoms, but yes, like you said, they're walking. Most of them are fairly ambulatory, things of that nature. That's why out of the 136, the Guam Fire Department has actually handled a very smaller percentage of that, because most of them have either walked into their clinics or walked into GMH or GRMC.
Mm-hmm. And just for clarification, the COVID transport units, these are for just stable PUIs, not anybody that's exhibiting any kind of serious complications.
That is correct.
Okay.
Yeah, thank you for that clarification, because the COVID transport, like I said, are those seemingly stable. But if we receive a call and our dispatchers think, no, this is somebody who is in distress and needs immediate attention, then of course the normal protocols for a response would be in play.
And then so when we roll out the normal response that's going to come from not from the COVID transports, are the firefighters at the different stations, do they have all the gear that they need to respond and be adequately protected from exposure?
Yes, that is correct, Chris. The one thing that we've also developed is in our supply chain, in the supply office, what they've done is they've taken all the required PPEs, the necessary PPEs for all of our responders, and we've built what we've called isolation kits, or ISO kits, and that has the mask, the N95 mask, the gown, the gloves, the eye protection, things of that, everything that they would need to properly protect themselves from a PUI patient.
Mm-hmm. So you have these 2 COVID transport units. What about sanitizing these medics when you're done? How long of a downtime is that?
Well, and that's a great question, because that's kind of another one of the decision points that was taken when we taken into account when we made this decision, was the considerable downtime for the rest of the operational ambulances, so to speak. That kind of helped drive the decision that we wouldn't take those ambulances offline, because it was taking anywhere for about an hour and a half to thoroughly sanitize ambulances after transports. I mean, we do that on a regular basis with every patient that we transport, but there's a little bit more emphasis and detail placed on any PUI transports.
Okay. I did want to ask, because it was mentioned during the press conference yesterday, because we've increased our capacity to do testing. Still kind of trying to figure out just how many test kits we have. But one of the things that the governor mentioned as we move into this next phase was how the National Guard, they're going to start testing all their people, and police department, firefighters, everybody on the front lines. How are you going to roll that out in terms of testing all of your firefighters?
So the method that we're going to be utilizing is obviously the priority personnel that we want to have tested are those who have actually been out in contact with these potential PUIs and surveillance patients. Anyone that could possibly have come into contact, whether it would be at home or during their responses. And then we were going to eventually wind up, as those test kits start to roll in more and more, just wind up testing the whole department when we get to that point.
So how many do you plan to initially test?
Right now, I believe that the pilot testing that the public health and the Guard are going to be doing, I believe we're going to have anywhere from 10 to 20 of our personnel initially get tested, and then again, as more tests come in, we'll go ahead and continue to submit those names to get tested.
Is that an issue, Chief? Because you said when more tests come in, are we dealing with a test kit issue?
Well, no. So what's happening is, if we have a high suspicion, or if one of our personnel winds up, say as the example, we roll into a scene and we get the call, and it seems like it's a fairly routine call, if there's such a thing, and then we find out later that person wound up testing positive. Obviously, those responders would get tested, and based on the priority set, that they would be of a high priority for testing. So. Right. Those that have had those potential exposures have been tested already, and I'm very happy to say they've come back negative. Wow.
So no firefighter at all has tested positive.
That is correct, and we're very, very happy for that. And that's a huge testament to the safety mechanisms that we've put in place. Mm-hmm. With each one of these COVID transports, there's actually what we have is an infection control supervisor at the scene. They're not directly involved with patient contact, but what they do is they make sure so they're there as the extra set of eyes to make sure that our personnel are donning our PPEs correctly, and even more importantly, once they get them to GMH, mm-hmm. and there is the doffing of that equipment, because mm-hmm. that's where they're most susceptible, is when you're taking that equipment off.
Wow.
So no one tested positive. How many were tested?
So if I recall accurately, I need to get that number, that correct number for you. But we've had, I believe, 2 of our personnel tested. We've had to home quarantine a few of them. But once we got the results back from that particular patient contact, because we were a little bit concerned. Once we got the negative, through consultation with public health and our medical director, Dr. Jolene Uggan, they said, okay, that's good for them to return back to work.
How many firefighters? How many people you have in GFD?
We're operationally, we are about 234.
Okay. So you tested only 2?
Two for because they had potential exposure.
Okay. How many again on home quarantine?
We had up to, I'll get you those numbers, Sabrina. I believe it was about anywhere from 14 to 16 of our people, and that wasn't because they were in contact with any that many patients. It was, we also had some of our personnel who were returning from travel, and because they were returning from travel from those areas initially. Mm-hmm. Out of an abundance of caution, we went ahead and placed them in the home quarantine.
Okay, so no one tested positive, but only two were tested, and with this new phase into testing, only 10 to 20 are initially going to be tested until more test kits come in.
Chief, do you want to see a bunch of your guys get tested? Are you satisfied with this 10, 20 here?
Well, initially, yes, because there is a protocol for testing, and right now, our crews are doing phenomenal work, and they're doing their very best to get it right all the time, and that's reflective of the amount of people that we have that are not positive. I'm sorry, that we don't have any positives. So they're doing their due diligence, and they're being as safe as possible. And I don't know what else I can say. They're just doing really great.
Yeah, I'm just saying you guys are front line,
right?
And it just doesn't seem 10 to 20 is enough, because you guys are responding to people who are sick, asymptomatic for
I think you guys are
COVID.
right there with the nurses and the doctors.
Yeah.
Well, that's a very good point, Chris. And the fact is, we only have the initial amount of kits that are arriving, and so because Guam Fire Department is not the only one that is making patient contact, of those kits, the governor wants to make sure that we're testing as many people as we can, but we also want to be able to share that test capability with everybody else that is coming into contact with these patients.
Chief, where are we on the hazard pay? Is everybody in the Guam Fire Department who is supposed to be getting the hazard pay getting it?
So that's correct. So everybody who is eligible for the differential pay, is that what you're referring to?
Yeah.
Yes.
Okay, so the announcement the governor had about, was it like 25% for first responders, and then there was like a sliding scale. All your guys are implemented, and we've seen that in the paychecks?
That is correct.
Okay. All right. Anything else, Bree?
I don't think so.
Okay.
I'll probably get a few text messages after this.
Chief, thank you so much for making the time. We hope to get you on. I mean, if there's anything you want to get out there, we want to get it out there. So if there's stuff that you want people to know about the COVID transport, or, anything that's going on with the Guam Fire Department, you got our number, shoot us a message and we'll get it out as soon as we can, okay?
I appreciate it very much, both of you.
Thanks,
Chief. Of course, Chief. Wash your hands.
Be safe.
Thanks.
Okay.
You too.
Okay.
All right, take care.
All right. Chief Dan Stone of the Guam Fire Department. We're going to take a break, and then we're going to flick the big switch and jump over to KUAM TV 11. It's the KUAM News.